The most important part is you have to be very numb. So a lot of times patients, if they've had bad experiences with extractions or feeling something, they may now have been fully numb. So one of the important things is I really don't mind giving a lot of anesthesia, so to make sure the patient is comfortable. And another thing is sometimes dentist office, or if they're very busy, we have to rush. So we may not have time for the patient to wait and get longer if there's other patients waiting. For us, that's a big part of how we book and how we schedule. I want to make sure I have enough time for each procedure. So we want to make sure that the patient is numb, and if they're not numb, we give them enough time to get more numb before starting again. In my experience, the most important part is they have to know that I'm not trying to hurt them. If they feel like I don't know if he's trying to hurt me or if he cares more about getting the tooth out than my comfort, then it will be definitely a lot more scary. So I spend a lot of time reassuring the patient that I want you to be very numb. And if you feel anything, I'll give you more. I'm not trying to hurt you. I want to make this as easy as possible for you. And then most patients who are nervous, they tend to relax a bit. And as long as I reassure them before, then they're going to feel better during the procedure. It's like total game changer. I think it's an extra layer of protection that the patient feels before they come in, before they even start. A lot of times, if we have an extraction scheduled, I just think about what tooth needs to come out, but the patient is thinking the day before, 2 days before, I need to get this tooth taken out. What's going to happen to me? So if we offer some medication for the patient to take, they feel an extra layer of protection and they're a little more calm before they come to the office. So, one of the small things we do is we make sure the patient knows what tooth number we're taking out and everyone says the same number because that could be a scary thing. Are they going to take out the wrong tooth? There's so many questions that could come into your head. So, we do small things like that just to make sure the patient knows, we know what's happening, and we're all on the same page and we're not going to do anything crazy. Before the numbing wears off is begin taking some pain medication. So a lot of times it's Advil or Tylenol for patients, whatever they're more comfortable with and helps them better. So it would be good just to, as soon as they go home, begin to take it so it's in the bloodstream. And another thing that's very important is biting on the gauze firmly, not too hard, but biting on the gauze that we place right when they leave. Making sure the bleeding is under control is super important. And then also, the last thing is just in case there is still like a lot of bleeding, perhaps we do a extraction in the afternoon and the patient um, still has like quite a bit of bleeding before they go to sleep. One option is to get like a black tea bag, wet it, and then suck on it. There are things in there that help control the bleeding. So, what to do just in case that situation comes up. A lot of young adults, they don't think about what's going to be like when they're 60. So that is a very important thing to think about. And it's hard to imagine, but there are many older patients who get large infections when they're older around wisdom teeth they didn't take out when they were younger. And they all say, I wish I took my wisdom teeth out when I was younger. The older you get, the slower healing is. So when someone is really old, the healing is super long. But when you're young, you don't realize it, but the healing is actually going to be very quick. So I strongly recommend that young adults, late teens, early 20s, get their wisdom teeth taken out if they've been through the gums at all. There's a huge range of possibilities. If it's totally under the bone and gum, it may not be needed to be taken out, and the process of taking it out may be a lot more traumatic than just leaving it in. A lot of times, patients will have just like a little bit showing, and that is actually the most problematic, is because the bacteria doesn't just stop right where the little opening is, but they can get all the way under there, but you can't clean it. That's when you get an infection very easily. So if any bit of it is showing, it should be taken out.